The Australian Commission on Safety and Quality in Healthcare have also put together a clinical governance framework. The purpose of this framework is to ensure that patients and consumers receive safe and high quality healthcare through integrated corporate and clinical governance systems. A healthcare organisation's corporate governance systems sets out its purpose, ethical, legal and policy requirements, as well as its workforce standards. The clinical governance framework sits within the broader corporate governance systems of a health service organisation. So the corporate governance system is the health service's overarching set of rules and responsibilities, and the clinical governance system sits within this corporate governance system. The purpose of the clinical governance framework is also to ensure continuous quality improvement of the safety and quality systems and processes within a health service, and ultimately to guide patient care so that patients are receiving high quality care that is consistent, meets their needs and ensures good patient outcomes. The clinical governance framework has a number of key components. Essentially, it defines what clinical governance is, and it describes the key components of a clinical governance framework for a local health service based on national safety and quality healthcare standards. The purpose of the national safety and quality healthcare standards are to protect patients from harm and to ensure the highest level of quality of care is provided to patients in health service delivery. Another essential component of the clinical governance framework is that it highlights the importance of a strong safety culture in supporting good clinical governance. This means that the organisation has systems in approach to survey staff around safety issues, that there's programs and training for staff to be able to speak up about safety issues, and that staff are aware and engaged in what a safety culture means and can identify errors and report these. The clinical governance framework also outlines the roles and responsibilities of all members of the healthcare team, including the patients, consumers, frontline clinicians, managers, as well as governing bodies, such as boards, in implementing effective clinical governance systems. Now, this graph depicts the essential components of the clinical governance framework, and as you can see at the centre is partnering with patients and consumers. The framework also includes that governance and leadership and culture play an important role, that the organisation has patient safety and quality improvement systems in place, that the organisation has systems in place for measuring clinical performance and effectiveness, and that the environment is safe in order to provide high quality and safe patient care.